About a day in your life where everything was going badly. You had gotten a bad grade on a test you were sure you did well on, you had a lot of homework from multiple subjects, and right when you wanted to go home, you got stuck in traffic. We all know how stressful and frustrating these situations are. This much stress for a human being is not healthy, and some people have to live with it because they don't know how to de-stress it or get rid of it. So what can you do when you get home to de-stress? A very effective way to de-stress is drawing or painting. You might be thinking, how can drawing or painting calm me down? Well, hear me out. Art therapy is a form of therapy that combines drawing, painting, sculpting, and other forms of art into a way of therapy to help people with anxiety, depression, PTSD, and other mental illnesses. In the UK, Adrian Hill was the first person to use the term art therapy. Adrian Hill discovered the benefits of drawing and painting while recovering from tuberculosis. Around the same time, Margaret Naumburg, who was a psychologist, helped confirm art therapy as a useful form of therapy. When someone says therapy, the first thing to come to mind probably wouldn't be art therapy, but therapists tend to use art therapy quite often to understand their patients better. In an article about art therapy, a therapist was doing art therapy with his patients who were soldiers to help them relieve from past trauma they had during their time in the war. Art therapy was invented in 1942 and is still being used to this day. Now, what are the benefits of art therapy? Studies have shown that expressing yourself using art can help people with depression and anxiety. It also shows that art can help with improving memory, reasoning, and resilience in healthy older people. Art benefiting someone doesn't have to do with their talent to the subject or how good they are at it. Juliet King, a professor of art therapy at George Washington University, said that art therapy helps people understand parts of themselves that they didn't know. Pastors trained and board-certified art therapists ask their patients to use clay, paints, and other materials. They talk with their patients about their problems and experiences, their aim being to understand their patients better and simplify their symptoms of a wide range of mental health challenges, from eating disorders and anxiety to Alzheimer's disease and depression. I am someone who gets stressed and anxious very easily, so to de-stress I have tried drawing to see if it benefited me, and it did. While drawing, I managed to get my thoughts under control and calm myself down. By getting my thoughts under control, I managed to figure out what was stressing me out. Drawing and painting is also a very fun hobby. You can do it in your free time. You might be thinking, how can something as simple as drawing or something a 5-year-old can do have such an effect on us that it's a form of therapy? Well, case studies do seem to suggest that treatments are effective. A 2014 review of 16 case studies and small experiments exploring art therapy as a treatment for dementia found evidence suggesting that art therapy may ease neuropsychiatric symptoms, raise self-esteem, and improve social behavior. It can also boost confidence and make us feel more engaged and resilient. Besides these benefits, our engagement also alleviates anxiety, depression, and stress. Now that you know a quick, effective way to de-stress, next time you're feeling bad or stressful, just grab a pen and paper and start drawing.